Imagine being in hospital in one of the most vulnerable and frightening times of your life, and you can't communicate with those who can help you most.
So we became actually quite frightened at the process of going through this without the language. We actually considered going back to our country to have our baby over there.
There's a high risk of misdiagnosis and there could be consequences to that.
The patient is due for a surgery. At that point they're asked, do you know what you're here for? And they, those kind of questions, just to make sure that it's the right patient and the right surgery. And we both realized that the patient is not aware of the kind of surgery that she's going to have.
The Interpreters Service has been bridging those gaps in New South Wales health services for the last 40 years, giving everyone access to equal health care.
The service started in Crown Street, Sydney, with a small number of interpreters, and then from there it grew and spread across the state.
It is important that the communication is, at least 90%.
We are feeling quite happy and quite safe that we know what the medical staff are saying to us through the interpreter.
I started roughly over 10 years ago, and it was basically because my parents are deaf. Sometimes you will experience barriers being deaf, but I do have a real can-do attitude. Yeah, I would feel sort of depleted, and I really feel a lot of confidence with the interpreter being there, because otherwise I'm left to rely on bridging that gap myself, and we do have two different languages.
We basically see patients from newborns all the way up to death and dying.
One of the interesting aspects of this job is that you really never know how your day is going to be like.
Myself and a community nurse went to visit a man, a Vietnamese gentleman. What he understood was that nothing more could be done for him because there was no more treatment for his cancer, and he was all alone in the world. So with the interpreter we were able to explain that palliative care is care. He just thought that he had left hospital just to die. So we were able to say it didn't matter that what culture he was from, that he couldn't speak English, and that he was entitled to care no matter where or who he was.
What we're trying to achieve is to employ a mobile system so that it doesn't matter where our interpreters are. 3 o'clock in the morning, if we had a deaf patient, video interpreting would be fabulous.
What I would like to say to the hospital and to the government is to say thank you very much for having this service available.
40 years is just so special.